Good morning. I am here today to discuss in this three-part series how to prepare for breast reduction surgery. My surgery will be 10 months, May 23rd. Originally, my surgery was scheduled for March 14th, 2019, and due to some health issues, it had to be rescheduled. Also, I had to wean off of vitamin E, D, and also long-term use of prednisone. So let's get into it. Maybe you're watching this video today and you're saying to yourself, I really want a breast reduction because I don't like the size of my breast for cosmetic reasons. And if that's you, that's your preference. Maybe you're a parent who stopped by my channel and you have a child or a teenager that's considering a breast reduction. I really want to take my time with this three-part series because this is a very serious decision. And just to give you a little bit of background about myself, I was 47 years old when I had my procedure. I was 46 when I discovered that possibly it was my breast that was causing me to have slip ribs in my back. I've never been an obese or heavy person, very active. And so when I started to have this intense upper thoracic, as they call it, back pain, I tried physical therapy. I went to chiropractors and the manipulations weren't holding, and I was just so frustrated and the pain was so unbearable. I just was like, oh God, I don't know what to do. So in 2017, I gained a lot of weight getting injections. I lost 40-50 pounds, but my breast size increased from a size D or double D cup to a triple F. So I had never had large breasts. So that was part of the reasoning for my excruciating back pain. I had now these heavy breasts at the time were pulling on my back. I also already had back issues, so it just intensified everything like 20 times worse. Again, it was very excruciating. So I wrote down some notes and some things for part one that I feel would be helpful in preparing for the surgery, the day of surgery, what to expect, and when you return home. So part 2 and 3 will be regarding the weeks following, and also the final part 3 will be on the issues that I faced after my surgery. I didn't want to put everything in one video because it would be too long, so I decided to break it down. But this, like I said, it's a very serious decision, and I just felt like I need to do this video to help someone today. So you're saying to yourself, okay, I want surgery for whatever reasons you may have. So first you need to prepare before you even think about having a surgery. So here's some things that I did to prepare. You want to talk to your physician. Discuss with your physician what's going on. And 9 times out of 10, they're going to want you, before they do a prior authorization to approve your surgery, they're going to want to see that you tried different bras, sports bras that help support, your large breasts. They want to know that you tried physical therapy. They want to know that you tried chiropractic therapy. So all these things will help. Just a note. Having these additional reports will help in your insurance possibly approving your prior authorization. And that prior authorization could take weeks to months. It just depends on how busy the prior authorization department is. I'm getting a little bit ahead of myself, but I just wanted to make sure I let you know that. And again, you want to research plastic surgeons. I had one appointment. I went in, I didn't really feel comfortable. I didn't know a lot of questions to ask, so I was kind of blindsided. He was a very arrogant plastic surgeon. He wouldn't discuss things with me as far as how much he would take out, and we just didn't vibe. So I left there a little bit discouraged, but my sister had the procedure 3 years prior, and a couple of the relatives. So I just kind of reached out and said, look, I'm thinking about getting this done. I'm having excruciating back pain. They're talking about taking cartilage and things out of my back, and I have to do something to help myself. And it's got to be the size of my breast that's causing my ribs to slip out and to cause the slip rib syndrome. So my cousin had told me the first consultation that I had, this person did her surgery, and she also said that she did not like the way that he talked to her, and he only would take a certain amount out. So she said if she could have did things over, she would have went to the surgeon, the plastic surgeon that my sister went to. So first I had to find out if the plastic surgeon that my sister went to, if he accepted my insurance. So I contacted the office. Once they told me that he did, I went on, I read reviews on Google, and also I took into consideration that my sister had a pretty successful outcome. So you want to research these plastic surgeons in your area. The next thing I did, again, don't be afraid to get a second opinion. As I stated before, I didn't like the vibe that the first plastic surgeon had, and so I got a second opinion. The next thing I have is, again, talk to your family about any concerns, if they've had the procedure, who they recommend. Again, I did say that most insurances, and this is important to know, the requirements for breast reduction, if you have a BMI, a body mass index, that's over 30, that is possible grounds for not getting your surgery done. So that's something you want to think about. If you're overweight and you have a BMI, a body mass index over 30, you may want to consider losing weight, because if you think about it, if you're heavy and you get the reduction done, once you lose the weight, you'll still have these big breasts. So you want to have your, weight proportionate to the breast size that you're going to go with. Next I have, and I think this is important, before the first consult, you have to prepare mentally. You have to know, okay, am I going to be mentally ready to handle all this? Because you may be going into it thinking, oh, it's nothing but a breast reduction. You hear stories about how successful they were, but you don't necessarily hear all the stories about the bad outcomes. And even though I am 80% satisfied now, I did have some things happen that I will be discussing in the next videos. Do you have kids? Who's going to take care of the kids? Are you married? Are you single? What about your job? Do you have medical leave? Do you have FMLA? Those are things you need to consider. The lack of intimacy. Because you will be down for 6 to 8 weeks or longer, like I was, there is a possibility you won't be able to be intimate with your husband or your significant other. So you have to prepare yourself mentally, especially if you live alone, who is going to help you. And don't think because you're a superwoman that you won't need help. I thought the same thing. I needed help. I didn't need as much help, but that those first few days, that first week, you will need help because you won't be able to raise your arms because you'll have stitches, bandages, and some ladies do have tubing. So you may have drain tubes. So you're going to need help. Don't think that you won't, and you will not be able to drive yourself. You are going to need to have someone accompany you. You're going to be under anesthesia. When it's over, you're going to be lightheaded, nauseous. You're going to be nauseated, in a lot of pain. So you are going to need help. So those are some things to consider to prepare mentally. How are you going to react once the procedure is over? A lot of us go through, post-surgical, it's like having a baby. You go through, post-traumatic, postpartum depression. And it's like, kind of like you go through, I'm just being real with you and honest with you. You will have some level of postpartum after you carried these big breasts for so long and now they're gone. It's like you got to get used to having smaller breasts. So those are some things you need to prepare for mentally. Next, like I said, even before your consult, before your first consult, you want to do a little research on the internet. You want to take notes. Don't be afraid to ask questions. No question that you have about your health and this serious condition is a silly question or a stupid question. Whatever question you have, that plastic surgeon should make you feel comfortable and at ease. And if that person doesn't want to answer your questions or doesn't make you feel at ease, I would get a second opinion. So at my first consult, I came in, they took me to a room. After I filled out paperwork, took me to a room. I sat down and watched the video of the procedure. Afterwards, I was taken into an exam room. They were asking me questions about, why I wanted the procedure, stuff like that, how long I had been having the problems, if I tried physical therapy and any other therapeutic measures to help with my intense and excruciating back pain. Went over family history, medical history, and things of that nature. So then I had to undress, and just the top only. He took measurements while the nurse was there, took measurements, did markings, and then he kind of discussed with me, and he was very, very arrogant. I did not care for him. And he just let me know up front, I only do X amount of pounds, and that's it. And so I'm in here, this is my first time, I'm still in shock that I'm even here getting a breast reduction. I've never had large breasts before. So I'm in here, I'm nervous, very emotional, and he kind of shot down things that I was asking him. Like I was saying, sir, I just can't even believe I'm in here. I've never been a person with large breasts, and, I'm a little nervous. And then he really was getting sarcastic, and I just, wow, was like, I left that appointment. I remember calling my sister, and I told her how the appointment went. I told her I need to possibly get a second opinion. Can I do that? Because she works for my insurance company. And she said, yeah, you don't have to go with the final decision from the first person that you chose. So I went ahead and got, like I said, a second opinion. When I went into that second opinion, I was so comfortable. And his name was Dr. Algam, and he's in the Flint, Michigan area. So I was so comfortable with him. He made me feel so relaxed. He showed me photos. He was just very open to the process of helping me with being comfortable with this whole decision to have this breast reduction. So next I have here that there are some things to consider before you have your what's called a surgery consultation. So you went through the process of getting approved by your insurance. Fast forward, you make an appointment or they contact you from the surgeon's office. Okay, you got approved. Your approval will be for so many months. And you can go online. If you have an online account set up, you can go on and check and see your authorization. A lot of times they will contact you and let you know that it was approved. And so I believe my surgery was approved from, I think, February of 2019 to August of 20, so about 6 months is when the approval is good for. So again, even before you have that pre-surgery consultation, that's when your surgery is pretty much scheduled. They just want to come in. The doctor will kind of explain to you what will happen. The emergency room department or registration from the hospital will contact you. They're going to want to ask you a lot of questions about your health. If you had any blood work done recently, your medications, your health history, and at that point, they can postpone or cancel your surgery based on what you tell them. Remember what I said about your BMI, your body mass index. It needs to be below 30 in order to really be considered, in most cases, for your procedure. So the day of your, this is your second consult. You want to ask all your questions to the surgeon, you know, what's going to happen, you know, during the surgery, before the surgery, during the surgery, and after the surgery. You want to discuss the cup size and everything with him. And he will make sure he tells you, he or she, will make sure they tell you they want to make sure that your breast size is going to be proportionate to your height and weight. So it's kind of how they're determining what you want to do. I said, like right now, I am what's considered a CD or a double D. When I went in, I was a 44F, which is pretty big. And I will be posting pictures so you can see what I mean as far as how large my breast size were opposed to what they were before I gained all that weight. And so now I'm what's considered like a 44. Depending on the bra, I can fit some 40s. So 40 CD or double D is what I am now. And I am satisfied with the asymmetry and the size and everything, although I did experience what's called necrosis. Very dangerous situation. And so I will get into that in the second and third video. Okay, so back to your appointment. So they're just going to let you know, basically how to prepare, wait for the hospital to contact you. They'll tell you what time you need to be there, what you need to wear, what you need to leave at home. You can't eat 10 to 12 hours prior to your scheduled surgeries and things of that nature. So again, you can go in like the day before your surgery just to eliminate time. I asked if I could come in and do the blood work that needed to be done. And so they allowed me to come in to do the blood work. That way I was prepared. So when I went in that morning, I was a little concerned. I wanted to know, if all my blood levels were good and if they were going to try to postpone my surgery. They do have that right. If you come in that morning and your blood work is not good, high blood pressure is up, things of that nature, they do expect a little bit of anxiety. And, if you're in pain, your blood pressure will go up, but it's up to the doctors and everybody to discuss that with you. And so there is a possibility that your surgery could be postponed. Again, my surgery had to be postponed due to the fact that I was on long-term steroid use for rheumatoid arthritis, and it was increasing my blood sugar. And so the outcome basically is what the surgeon told me in our meeting. It could cause poor healing. And so I didn't want to have the surgery done and have a chance that it didn't heal properly. So even though I was disappointed and that my surgery was scheduled for March 14th, I had to wait 90 days. And I was disappointed when my doctor told me that she preferred that I waited 90 days to have the surgery, just to make sure I was properly weaned down off of the prednisone. I was only on about like 10 milligrams in the winter, 5 milligrams in the spring, summer. But she still wanted me to safely wean down because there is something called an adrenal attack that you can experience. And I didn't want to chance that. So even though I was disappointed, I said, okay, that'll give me more time to prepare. And I'm sure you've noticed all these things that are on my table here. So I am going to go over all of these things with you. A lot of the things on the table basically are for when you get home. So the reason why I have them here, because I want you to be prepared if you are going to proceed with going ahead and getting your breast reduction. So next, again, they will, tell you can't wear any jewelry, wear loose-fitting clothing. If you have removable dentures, teeth, body jewelry, you cannot have those things in. No makeup, nothing. So now you're prepared for surgery. Again, I did my blood work the day before just to kind of minimize some time. So the day prior to your surgery, you want to be prepared. You want to make sure that you have everything at your bedside that you are going to need, because again, you will not be able to raise your arms for at least 6 to 8 weeks. It'll feel like something is pulling, and you don't want to pull your stitches loose and go back to the surgeon and have to have another procedure. Not good. Okay, so moving on to the night of your surgery, they will tell you that you have to take a shower. They want you to shower with Dial soap, antibacterial soap, and also they want you to shower again the morning of your surgery before you go to the hospital. They want you to take another shower. Do not apply any lotions. Don't apply anything. And remember to wear, your loose clothing. So let me just show you what I mean. I wanted to really, really give you an idea of what to expect. So here is what I wore the day of my surgery. So I was reading in different groups to wear like a button-down flannel shirt. This is bringing back some memories, guys. I had a tank top. Do not wear a bra because you will have bandages, underneath, so you won't need a bra. And, so this is just a flannel shirt. I think I picked this up at a thrift store a week or two before my surgery. And I also had on some comfortable jogging pants. You can see these. Something with a stretchy, stretchy band. You don't want something on too tight because you're gonna have to slip this stuff off and give it to your significant other or whoever is there with you when they collect your items during registration. Again, you want to have comfortable shoes. I wore my Crocs, and because you will not be able also to bend over. That's another thing. You will not be able to bend over. So you want some slip-on shoes. Also, preparing for the morning of surgery. Again, you will not be able to eat anything. So, and they will tell you what medications you can take, what you can take the morning prior to your surgery. So, they will also tell you, day of your surgery, you're going to arrive. You want to go to valet. You get the ticket from the valet, whoever's transporting you. Please have a driver. You will need a driver. You're going to be nauseated possibly. You're going to be under anesthesia, still going to be in your body. You will not necessarily be able to drive yourself. I would not chance it. I would have someone there with me. And so, again, no driving, ladies, no driving. So, whoever's transporting you is going to be in valet. They're going to take the ticket. They're going to take it to up to the nurse or whoever's on that floor to get you validated. Okay, so you're going to do patient registration. If you were there the day before, like I was, and did my blood work, you don't have to go back through the patient registration. They're going to give you the tag to put on your arm, the name tag with all your information and everything on there. They're going to tell you to have a seat, and then they may just direct you to the elevators, and you go up to the floor. And when you get off the elevator, there is a patient waiting nurse. Just like with any surgery, you check in with that person. They'll give that individual, in our case, in Michigan, we use the pagers. They'll give that individual the pager and kind of keep them posted on what's going on with your surgery. So then you will go and they'll direct you to the area where all the patients are waiting for their surgeries. You'll go, you'll get your weight checked, and you will also need to give a urine sample. And so once that is completed, they'll take you to one of the bays and ask you some questions again. They'll get you prepared for the IVs. They'll put the monitor on your finger to keep track of your blood oxygen level. They'll have you change and all that, of course. And then they will have your significant other. They give you have you write down everything that is on your person and everything that is in the bag when you put your clothes and everything. And so you'll sign a bunch of forms. Your Ertograph is going to be popular that morning. And remember, you're already going to be kind of nervous. You're going to have anxiety. Just kind of relax. Take it easy is the best way I can say. If you pray before you go, kind of meditate. This is a very life-altering decision that you will be making. Of course, if you are a teenager or under the age, I think, of 25 it is, you have to possibly have a parent or guardian there with you, even before it's you get an authorization possibly. So then you have the nurses. Everybody's kind of running around, getting you hooked up, and you change your clothes, and you got your shower cap, little shower cap and stuff on. You got your little footies on, giving your items to your significant other, and they're kind of still sitting there for a minute. At that time, the anesthesiologist will come in, and at that point, you can discuss with them. Be honest, don't be afraid to say, I'm having some anxiety. And although I didn't have a lot of anxiety, I did have, just a little bit, because this is a serious surgery. You're getting a trach put down your throat. You will not feel that because you'll be sedated and sleep when they do that. But just the thought of, not being able to wake up after a surgery, so many people go into surgeries, they don't wake up. So there is, some level of anxiety. So just be honest. They will give you, a little Ativan or something like that, just to kind of ease the nerves and the anxiety. And also, I was told, and this was a good recommendation because I have issues with motion sickness and nausea already. My sister said that she vomited a lot when she got home. And because I already have issues with that, it was suggested that I let the anesthesiologist know that I already, take promethazine for that. And if I could also have some, prior to the surgery. So everybody's come in, anesthesiologist has talked to you, and then your surgeon is going to come in. He is going to, open your top, do some final markings, discuss with you again what he discussed in that second consultation, the pre-op consultation. He's going to let you know what the expected outcome would be. But keep this in mind. If you're in the surgery and things are not going the way they should and he needs to medically make a necessary change, they will do that. Also, if you are in surgery, once they, okay, I'm getting a little bit ahead of myself, but I wanted to make sure that I let you know about that. Once you get wheeled in, after the surgeon comes in, does his markings and everything, they're going to wheel you in. You say goodbye to your loved one. They're going to wheel you in. And then you're going to be in this room with this cold slab. And for me, I just kind of was looking up, and then I would close my eyes and I would pray. Me, the one that's always been healthy and active, got into a situation that was, beyond my control. And it was like a domino effect. I got a steroid injection to help one thing, and then it caused something else. Just constant domino effect. But, I just kind of had to make peace with it, and it is what it is, and now here I am. So what they do is they will take your arms. You're on a cold table. Well, to me, it was kind of cold. And they're going to stretch your arms out. You're on the table. They stretch your arms out. They'll talk to you. You'll hear people running around. And next thing you know, you'll have oxygen around your nose. And a few minutes after that, you're asleep. So they do put a trach down your throat, and that's to make sure that you're breathing properly. And then they have you hooked up to a monitor, of course, to make sure all your vitals and everything are good. So depending on your surgeon, he would have discussed with you in your second consultation, your pre-surgery consultation, how long that your procedure would work, how long that he would be working on you, how long your surgery would be. So for mine, it was about 2.5 hours. He let me know that. We talked about the outcome. I talked about what can I expect. I asked a lot of questions. What can I expect after the procedure? Things like that. So after about 2.5 hours, I just remember waking up in post-op, and I just kind of looked around. I looked down, and I was feeling the anesthesia. I wasn't really nauseated that much because I took, he gave me some medicine. So I looked down, I saw these white bandages, and I was like, oh my God, I really got this done. And so while I was laying there, they were kind of, waiting for me to really come to. They gave me ice chips, and they asked me how I was feeling. And because, again, if you have any medical issues, asthma, diabetes, anything that could cause a problem during your surgery, they are going to monitor you closely before and after the surgery. So due to that injection that I had that made me gain the weight, that made my breast get large, like I said, it was a domino effect 2 years prior that kind of led to all this. So I was considered type 2 diabetic. So I did go to, and I forgot to mention this because I wanted to get into this in the second video, but because if you are diabetic, this is just a suggestion. You want to talk to your doctor about getting diabetic socks or stockings. And because I was new to, diabetes, I really didn't know too much, but I did a lot of research. So I talked to my doctor, went and saw her like maybe a few weeks before my surgery. And so this is like a medium strength, 20 to 30, and it's just a compression of the socks. You will have to have an appointment if you're not already getting diabetic care. That was my first time, so I had to go in, get fitted. You can't just slip these socks on. They teach you how to use them. You have to have somebody help you put them on after your breast reduction. And also, I had a different one, but I purchased this. It's like a sock aid. And this one is like a cheaper version. What you do is you slip the sock on, and you just kind of pull it up. But the other unit that I had was more sophisticated and had little clamps on the side, and it was like something I could really stick my feet in. But that was a little too much too, because you can't really bend down. So, but you do want to wear those socks for at least maybe a week or two, depending on what your doctor says how long you need to wear them. At least my doctor told me 7 to 8 hours a day for 1 week. After my surgery, I was still kind of sort of weaning off of the prednisone. I was like maybe on 1 milligram at this time. And she, you know, told me how to finish weaning off the prednisone as well. And so another thing that they gave me when I woke up, because I do have mild asthma and bronchitis issues, they immediately gave me this and told me, you're going to have to take this home, and you want to do at least up to, let me see here, I had to blow up to at least 250 once every hour, 10 times. And I had to do this for a week after my surgery. They want to make sure that you do not develop pneumonia, blood clots in your lungs. So this is really, really very helpful. So if you do have to, you know, get one of these before you leave, all you do is they'll slide it up for you, and you will have to expel, and you just blow it up. You have to blow in. So expel, breathe in. Let it go back down, and they want you to do that 10 times. 10 times an hour. Okay, so now we're at the end. You've woken up, you're orientated, you signed your paperwork. In the event, if there are any problems, like I said, again, thank God I didn't have any problems. If they have any problems where your BP drops, anything happens, heart rate during your surgery, they will stop your surgery. It's all about health first. So just, you know, keep these things in mind. So they rung the little pager for my husband. They went and got my glasses and, you know, my sweatpants and my flannel jacket. And they kind of just watched me as I got dressed. I was a little groggy, and they told me to expect that. They went over, you know, the aftercare instructions. If you have any bleeding, discharge, you know, pus. I didn't have drain tubes. Some ladies, again, they have drain tubes. I did not need drain tubes, but you do have to go back the next day. And when you go back to your doctor the next day, it just depends. When I went back to my doctor, the tape was on so tight, it felt like I couldn't breathe. So I expressed that to him. Also, they may make your appointment on that second pre-op consultation. They'll schedule your appointment for the day after your surgery. So they'll give you a time. You come back. You have to have somebody drive. But before I get to that, let's go back to when you get discharged. So your loved one comes. They wheel you. Keep in mind, you may feel groggy, lightheaded. You may feel nauseous, all that. They're going to advise you not to shower for the first 24 hours or until your doctor says so. They're going to tell you not to sleep on your stomach. You have to sleep on your back. And it's kind of uncomfortable, but if you have a bed wedge or a recliner or something like that, I advise you to use it with a lot of pillows. Some people recommend you sleep with a pregnancy or maternity body pillow. A lot of people say that helps, but I didn't use any of those things. So when I did get home, I didn't want to eat anything. I was so just kind of out of it still from the anesthesia. But I did make sure I tried to get up and use the bathroom. My husband had to help me put on the diabetic stockings, so I would have those, on. And also, you can put them on by yourself if you get those like gardening gloves. That kind of helps to pull them up a little bit easier, because there's like a whole video on how you have to put them on. Then you have to make sure your heel is in. You have to shimmy them up your leg, and it's a lot to it. So, yeah, that was a lot. I had a lot going on when I got home. Everybody's going to be calling you, but the only thing you want to do is sleep. So I slept on and off. I didn't want anything to eat, drink. I just didn't have an appetite. I believe I cried a little bit. Like I said, this is a very emotional experience that you're going to be going through. It's like psychologically, you have to, I really did this. And then some people so happy, elated. But for those of us who aren't elated, it's like, wow, I really did this. And I hope it helps my back pain, because that was the reason that I needed to get mine done. And so your first night, of course, is going to be uncomfortable. I had a lot of pillows. I slept in the recliner. Had my husband bring the recliner upstairs because I was just so uncomfortable. And that tape is just like squeezing. It's like squeezing you so tight to where you can't breathe, but it's necessary. But oh my God, it hurts. It's like you can't even breathe. So when I went in, I really didn't eat anything too much. I tried to maybe sip on some broth and, little stuff like that. My husband went and got my prescriptions, pain medications. My surgeon did not prescribe an antibiotic for me. Some surgeons do, in the anticipation in case you set up an infection, because that is possible for some individuals. But no, mine didn't. So my appointment, I made it for early in the morning because I didn't want to go through a whole 24 hours in the evening time or later in the day with these bandages and stuff. I wanted to go in the morning. So I went the following morning, July 24th, 2019 at 9 a.m. as soon as he opened. I get there. There's a couple other ladies sitting there in the same situation. Remember, you're going to need to wear loose clothing for weeks. You're not going to be able to reach. Remember I said you're going to need everything just like on arms reach level. It's like you're not even going to want to really stretch your arms out at all. And that's really just the reality a reality of the situation. I'm just going to remove some of these things that I already talked about. Okay, I didn't discuss these yet. Just want to move those out of the way. So, again, I did have saltine crackers with my best friend. I had them with me. You know, you're not going to want to go anywhere. You're not going to want to travel because it hurts so bad when you get ready to leave the hospital. And this was a note that they had told me, make sure you have a pillow with you when you go in for your surgery, because when you come out, you don't want, your breasts are so sensitive, you don't want anything touching it. The slightest thing just irritates you. So you want to put the pillow up under the seat belt. That way you got some cushion in between the seat belt and your breast. So that's another little tidbit to do. So again, when you go in, he'll check your bandages, and normally your bandages have to stay on for at least 7 to 10 days. I know ladies have mentioned with the drain tubes, some of them get them taken out, some of them have to keep them in. I don't know how many days, maybe 7 to 10 days. I did read a couple ladies say they have to keep those drain tubes in, and that is very painful and uncomfortable. So when you go to your next day appointment, you're going to get something like this if you don't leave the hospital in it. Like I said, I had bandages on. Every surgeon is different. I did not have a surgical bra on. So he wound up taking my bandages off. A lot of people have to keep their bandages on for sometimes 2 weeks, but I just couldn't stand it. So he took the bandages off, and then he placed me in this. But this is your surgical bra. This is one type of surgical bra, just basic white, basic white surgical bra. And you can also purchase, some bras before your surgery, but it's like a guesstimate because you run the chance of not actually being that size, or a little bigger, a little smaller, but your breasts are going to be so swollen. You have to take that into consideration. So you may want to go a couple sizes up or size up a cup until the swelling goes down. And so he asked me how I was feeling, things of that nature, to be watching out for any drainage, any kind of bacterial things. And I just had sterile strips everywhere, I'm looking at myself like, oh my God, my nipples are looking bloody, and they have to move your nipple when they do these procedures. It's like, to get the blood supply back, they move have to move the nipple kind of up, and you're just looking at all this, and psychologically it's a lot to deal with. I just have to be honest. And I think when I got home, I just broke down and cried a little bit, like, oh my God, I just went through this. And then you want to make sure you take your medication on time. Like I said, he didn't prescribe anything for me, but later on, and I know some people did get prescribed, like Cipro, K-Flex. Like I said, that'll be in my part 2 or 3 video that I'm going to do regarding the issues that I dealt with post-surgery. They will recommend that you have Neosporin, and you want to make sure you got some gloves. Make sure you got some gloves on hand. I got these from Amazon. These are the I think they're powder-free, nitrile powder-free exam gloves. It was 100 in this box for like $9.95. And like I said, I was prepared. I ordered this stuff before my surgery. Even though my surgery got postponed, I already had it. You're going to want, because your throat is still going to be dry and scratchy and raspy from the trach being down there, you want some type of cough drops. I like Cepacol. They're like the best on the market. Also, as far as like icing, he didn't recommend it the first day, but they did give me this little doojobby at the hospital. It's ice, like an ice bag, and I had it open last week. Hold on. I didn't use this one. I already had ice packs at home, and so, okay, I opted out. There's a little lever on here. I hope you can see that. There's a little lever here, and you bend that lever, and this pops open. Hold on. And that pops open. Then you lift this up like so. It's like a plastic inside. Most people are familiar with these from, you know, hospitals. You slide your ice in there, fold that back down. Again, you want to put that lever and it will snap. I really didn't use this one, but this is the one that they will give you, the ice bag that they will give you at the hospital, or your surgeon will give it to you as well if you don't have your own ice pack. But I couldn't do ice until day after 24 hours. You want to make sure you have some kind of wipes. They have, I don't have the wipes that I use because of course that was a year ago, but at the dollar store they have something called At Ease, and they're in a long pink pack, and it comes with about maybe 25 in the pack, and so they're very large wipes. And if you're not able, because some surgeons may say you can't shower, just depends on the surgeon, you can't shower, and so they'll tell you you need to wash your bedside. So either you're going to continue to use your Dial soap, and you're going to have to wash your bedside. If that's the case, you want to pick this up. They got these at the dollar store. It's just a dish pan over in the dish aisle. I think they also have them in the craft aisle. So you want to have something like this bedside so you can wash up in. Also, if you are able to shower, if you're still feeling a bit nauseated or the anesthesia is, you know, haven't flushed out of your system, you can use this to vomit in. You want to make sure, of course, you have hand sanitizer at all times, because you're not going to be able to get up and down as much as you think you will. Like I said, your doctor may recommend that you start putting this on after a few days or so. It just depends on the surgeon, but it's, you know, good to have. This is just a regular, original Neosporin, but they do come in stronger strengths. They do suggest, I was on a site and they suggested a list of items that you get. I believe it's called Pre and Post-Op Breast Reduction on Facebook. It's a Facebook group. They had a list of everything, and a lot of these things I didn't know about, and it was because of that list that I prepared and pre-purchased. Of course, peroxide, not alcohol, but you want peroxide, and it is a good, you know, antiseptic, first aid antiseptic. So get you some peroxide. This came from the dollar store, nice size. This is like a quart, 32 full ounces, got from the dollar store. And most of my items, you can get the antibiotic, the antibacterial wipes, everything from the dollar store. And of course, you want to have your pain reliever. If you don't get a prescription, some ladies don't take any pain medication, and some of us have to. So I had prescription Tylenol 4 that I was already taking. So they were reluctant to give me pain medication at the hospital, but they did give me a little bit of, was it Norco at the hospital, just for like 3 days, because it would be against the law for them to continue it any longer, because I already had some. But you can get these at the dollar store. This one came from Equate, but get you some pain relievers, some Motrin, Tylenol, and you want to make sure, again, when you are trying to sleep, you want to have something like this. This was on the list, and I did purchase this bed wedge. So this bed wedge, I think the height is about maybe 7 or 10 inches, and I just kind of slept with my back and stuff half on this. Then I went from, like I said, my recliner to the bed, and I got this on Amazon. I think maybe about 20 bucks, could be a little bit higher. But yeah, this bed wedge, very helpful if you don't have a recliner. Something else you want to have, I purchased this on Amazon. You want to have you a bed tray. That way you don't have to get you a bell too, ladies, so you can ding, ding, ding your husband to bring you things. But for me, I had all my stuff set up, and I will show you the pictures of the things that I had set up. I had like a 3-tier plant stand, and I had a lot of my items on that 3-tier plant stand. I had this nearby on the bed, so when I got home from surgery and the procedure, my medications, I had some water and stuff like that on there. You also want to have a cup with a straw. I believe mine is in the refrigerator because I still use it, because it's going to be hard to bend, and all you want to do is lay back. So the cup with a, nice cup with a screw on top, or a cup with a built-in straw, is going to be very beneficial to you. This was $16.95 on Amazon. I have the legs taped up because I don't really use it. I have it in the basement, but I just wanted to bring it up and show you. Also, you want some of these gauze pads. They will recommend, you get some gauze pads. This stuff you want to get before, so that way you'll be prepared in case, you have some kind of leakage. Some light blood will seep out. They'll let you know that. And if that's the case, you can use these, or you can either use maxi pads. If you don't have any gauze pads, use good old maxi pads and put them, you don't want too much movement at all, because the slightest little thing just is painful and is very aggravating. Now this is a very serious situation right here. So the anesthesia could make you constipated from the surgery. So I got these little cups. Like, comes in a pack of 12 at the dollar store. They're in the party section. These little cups here. So I don't have it here, but you can feel dehydrated afterwards. I had Pedialyte last year, but I didn't use it, so it got old and I threw it out. You can get the Pedialyte from the dollar store. You can pour your Pedialyte in here. You can put your medications in here. Anything that you need. Just make sure you have these things bedside. Again, they come in a 12 pack at the dollar store. This is for your, again, issues going to the bathroom because of the anesthesia. Again, you might feel constipated, and they do not want you groaning and trying to push, because you just had this serious surgery and you don't want to pull any stitches loose. You want to cough lightly. Everything you do has to be done gingerly. They really want you in one position for 6 to 8 weeks until you can go to your follow-up appointment. I got these from the dollar store. These were suggested, just some laxatives, stool softener. Most people swear by Correctol, but got these at the dollar store. Thank goodness I didn't have to use them, although I did have issues. I could not go to the bathroom because I wasn't really eating anything. So there was nothing to have a bowel movement in my system with. But I did have them on hand. Also, magnesium citrate. They use this in the hospitals. This magnesium citrate, also got it from the dollar store. And this will help you. It's like a saline laxative. You take it orally, just follow the directions, and you will have a bowel movement. It could happen within an hour, 2 hours, just depends on your body. I had vitamin E because it's good for your skin. They also have this at the dollar store. Like I said, most of the things that I have discussed with you today, I got from the dollar store. So in the event that your doctor tells you, okay, you can get in the shower, you want to keep in mind that you will not be able to reach up. You have to have either a detachable little shower head or something of that nature. Or if you have something like this, I used a bath chair because I have been battling plantar fasciitis anyway. I had already had a bath chair in the tub because it's hard to stand sometimes in the shower, and I have, you know, some other back issues going on. But something like this, I picked this up at, like, let's see, I think I picked this bath chair up at the Goodwill for like $9.99 about 2 years ago. And this is very, very helpful, this bath chair. Because if you feel like you get nauseated, or, you know, it can take some days for the anesthesia to wear out your system. You don't want to take a chance and fall in the shower. That's a big no-no. Also, I purchased this. This is a wall suction. This was like $9.99. Got this from Amazon, and you put it on the wall in the shower, and it's a gripper. So you'll have something to hold on to when you're getting out of the shower. You can put it as low as you need or high as you need, but you want to make sure, because you will not be able to get in the tub because of the stitches, bandages. You will only be able to wash up bedside and take a shower. So I do recommend it. Is has little grips in the middle too, so you don't have to grip it. Just to know that that security is there helps a lot. Then lastly, you want, I got this from the dollar store, you want something long like this to wash with, and you want to use antibacterial soap for as long as your doctor says. With this, you can really get, turn around and show you. You can really go down without really, you can, but for me, I didn't use it this way. I just kind of used it this way because I really couldn't move my arms after the surgery. So I just kind of, you know, did it a little bit this way, very lightly and gently. So, also got this, nice little wash loofah, they call them, from the dollar store. So we've covered a few things in this video, and in the next video, again, we're going to talk about what happens when you go in for your 6-week checkup and beyond.